Hi, it's me again, and I'm very happy to welcome you to the last session of the last presentation of our session. And I'm happy to introduce you to my co-author, who is the first author of the research, Om Desai. Om, would you introduce yourself, please?
Thank you. My name is Desai, and I'm going to the Academy of Information Technology, and I'm really interested in data science and how data science can help deal with pandemics like the COVID-19 pandemic ongoing.
So we are very excited to present our research um, in this session. And the topic of our research is data mining COVID-19, opportunities, challenges, and implications. So will discuss more about the motivation of our research.
So the motivation of our research is multiple. We know that knowing the risk of infection or personal mortality can be crucial because it lets people know their behavioral responses. If someone knows that they're at high risk for COVID-19, they're going to do more to stay safe and they're going to be safer overall from the virus. Thing is, there is a wide array of factors that can contribute to the personal risk of infection or mortality. There are factors like age, location, other health conditions. And so, with all these factors, it's hard for a human to combine all of them and create them into one metric that can measure risk. But we can do it using data and machine learning to basically integrate all these factors and use it to help us understand the personal risk of COVID-19, help us understand the spread of the disease, model the effects of possible policies, and model the effectiveness of different responses to COVID.
And when we are talking about this risk of infection, day in and day out, we are struggling with a lot of decisions like whether I should go out, whether I should not go out, should I go for grocery shopping, should I go to a meeting, should I go to the work or not to go to the work. These decisions are constantly being affected by our information about how much I am at risk. So if we can come up with a system or better system of risk prediction, it can help many of us making more informed decision that can keep us safe at the personal level. But not only that, it can also help us seeing all how the macro level and micro level factors interact with one another and does this complex interactions. So to study this further, we started our research with extensive review of literature on this topic to see what is done in past and see the research done. And we realized that since the pandemic, lots and lots of scholars across the different disciplines have done phenomenal things and made a lot of contributions to advance the knowledge in this field. And this knowledge comes from many different disciplines like medical, public health, data science, artificial intelligence, engineering, logistics, supply chain, business. The research came from a lot of disciplines. And in our literature review, we realized that a lot more research was done in the medical field when it comes to risk prediction, but those medical risk research is only one of the factor. When we see the bigger picture, there are a lot more factors like the social factor or demographic factors or racial factors, and like whether you commute or not commute, and all these factors interact with your clinical data, with your medical conditions. And these kind of interactions is not something that is very clearly evident in the research. So would you like to discuss more?
Thank you. So we know that a lot of the data currently on risk prediction is fragmented into a lot of multiple disciplines. For example, one of the studies is about GIS, spatiotemporal forecast data, and helps us track the location and time of COVID cases. Another study is based on tracking genomics data of different COVID viruses. and some are researching using census level data, patient level data, and clinical research data. Our goal is to combine all these factors into one measure that can help us model and predict COVID-19, the spread of COVID-19.
So when we critically analyzed all this research, and it's this all different research use different set of data, and they all of them had their own strength and limitations, and this is what we studied in our critical review of literature. And one thing we realized at the end of our review is that there is a considerable dearth of research on a holistic framework that can help us generate insight among the complex interconnections among this large set of fragmented interdisciplinary factors affecting epidemiological risk. So, because a lot of research did happen in the disciplinary silos, when it comes to the holistic picture, this data or these approaches are also in this disciplinary silos, and that's when if we develop a holistic framework and system, we can put all this together at one place. Further research into the subject, we came across something very interesting that we found extremely useful is the research and framework developed by a lot of MIT scholars and researchers and the team led by Betty Massa. And their research provided a great starting point in this direction of developing one holistic framework. So they used different types of data which come from different level of analysis, and they provided a framework that used this descriptive analytics, predictive analytics, and prescriptive analytics in such a way that can predict the risk score and also help us better respond to pandemic with the policy level. So despite the development of a significant amount of research and some initial framework and starting point, the development of holistic framework and an integrated information system for epidemiological risk prediction needs more attention. And if we can have such system, it can make us better prepared to respond to pandemic, and it can make us better prepared to make better individual level decisions.
So, our objectives for this research are to build a system for epidemiological risk prediction and responses so that we can better predict the COVID-19 and be able to figure out where the virus is going and how to stop it. To do this, we need to develop an approach and method for predicting risk using health, genomic, and social factors. After that, we need to explore future opportunities and implications for health tech and fintech innovations.
So to meet all these research objectives, our starting point has been the work already done and this holistic framework that we already had available as our starting point. And this work is by MIT scholars. And I would start with explaining what is already done in this field. So what they did, they started the research with understanding of the cohort level data in clinical research. So this data provided a very interesting insight into the patient characteristics and what patient characteristics can lead to infection risks and which patient characteristics are more inclined to lead to the mortality risk. And this clinical understanding into mortality and infection risk provided a foundation into further or better predictive models. And then they gained the data, the patient level data from electronic medical research records, the EMR, and they used this patient level data to build the predictive model to predict mortality and infection risk. On their website, you can find the COVID-19 risk calculator. And if you see the risk calculator, they ask you this two questions like, do you have test available or you don't have test available? And based on what you choose, they ask you a few questions, and based on that, they provide you a score. What is your risk of mortality and infection. And I think that risk can provide a very useful insight into triaging and treatment. This patient characteristic can also provide the parameters into better prediction of the policy intervention and the census use of census level data. And this kind of prediction and policy intervention can help us provide more insight into social distancing policies and better resource allocations at the macro level. And this framework is a great beginning point because the strength of this framework, or what we really like about this framework, is how beautifully they have integrated different level data. So the cohort level data provide insights to the the mortality risk, which is again taking place at the patient level data, and how this patient level data further inform the census level analysis and simulations and resource allocation. So I think that the step-by-step approach has been a huge strength and inspired our research further to move in this direction. Despite this strength, there were some issues of this research that needed to be addressed, and will address in more detail. Oh.
So there are some issues with the MIT survey. So one of the things that it's missing is that it takes only a few factors into consideration, like the heart rate, the breathing amount, whether you're tested, some basic things about testing, and your age. So it doesn't take a holistic view of a lot of factors like other health conditions, location, genomics. And so our model would put together all these factors in order to basically create a better model that takes into account more things.
So as O mentioned, that in addition to the EMR census level data and clinical research data, our model also look forward to integrate the web-based self-reported data, GIS and spatiotemporal forecast data, in genomic data. And I think GIS and spatiotemporal forecast data is one of the key important factor defining or giving practical insight into what is going on. For example, this is more like when we have this weather forecast, this is something gives us insight into what is going on in our neighborhood. And when we integrate this, and this is a dynamic situation, and when we integrate this data with the web-based report, self-reported data, or the MIT COVID calculator, what they have created, this can give you practical insight into not only what is your own risk, but what is your own risk in the context of where you are. And this can be a huge improvement in terms of practical day-to-day decision based on your predictive risk modeling. In addition, we also look forward to integrate genomic data, mobility data, web data, contact tracing into a single framework that create predictive and prescriptive modeling.
So our method, first we use data integration and preparation. So we basically used feature reduction to narrow it down to the most significant features. And we also prepared the data by removing data that could do collinearity or data that is unrelated. After that, we cleaned the data. We removed data with lots of missing data points in order to get a more full test set and build a better model. Finally, we created our model and we evaluated and tested our model and found its accuracy. So our model takes many different factors. So for one, it takes web-based self-reported data from Nexoid. And so this is good because it helps us get a very large sample with many different factors in it. For example, it takes whether you have COVID-19, whether you have a whole lot of other conditions, which country you're from, and which time you took the survey. In addition, we get spatiotemporal data, which is like location and time you took the survey in order to better track COVID cases. And we also take genomic data. And we can use this genomic data to basically determine where a virus, certain virus is from. For example, if we can find the genome of a COVID-19 virus, we can compare that to the original genome from Wuhan, China, and we can figure out how far away it's gotten from that genome, and we can figure out where it's from based on that. This allows us to better figure out where the virus is spreading from and figure out whether it's internal spreading or whether viruses are coming in from somewhere else. We are not using these yet, but we intend to expand to include mobility and web data to basically be able to see where people are moving and use web data to better track how many people have COVID. And we plan to use contact tracing and individual level contact data to better model how COVID-19 is transmitted through contact. We're also using MIT Scholar Research to use census level data, clinical research data, and patient level data to determine which features we should weight more heavily and how we should make our model best. Combining all of these, we can predict mortality and infection risk, and we can run simulations on complex interactions to figure out what we need to do to help stop COVID.
So, based on this complex interactions, it can also help us visualize not only the policy level intervention, but it also can see us visualize the impact of individual level decisions, like how our decision can change what is taking place in the external world. And this is something can be very insightful. So the findings of our research is the descriptive analytics on the patient characteristics played a key role in feature identification and selection of predictive model building. I think that's what our starting point was, and we found this insightful.
Another finding we had was that integrating the dynamic GIS and spatiotemporal forecast data along with local policy intervention data into existing risk calculators, for example, MIT Analytics or Nexoid, added a significant amount of insights in terms of behavioral responses. In addition, leveraging genomic data to determine the country of origin of a virus and integrating this prediction into existing models can help determine whether a virus is from internal spreading or whether it came from somewhere else. These strains of the COVID-19 virus can pose different risk levels, and you might have to modify a vaccine to be able to counter these strains.
And such data integration can not only improve predictive insights, but are crucial in determining and understanding effects of individual behavioral responses.
So some of the implications for health tech here are that online data sources and data visualization can be used better in order to detect diseases early and make better decisions. In addition, using this combination of factors, we can create early warning systems and rapid case identification to identify early trends and figure out where the virus is going and help people stay safe. In addition, we can interrupt transmission using contact tracing and figuring out how best to intervene to stop the virus using mobility data.
And this system can also provide better insights into health insurance risk classification models. With IoT devices and embedded sensors, the emerging insurtech can help reward the individuals with healthy behavioral responses while facing the pandemic. And this new IoT wearable device data can also contribute towards creating more analytical opportunities and insights.
So in conclusion, we developed a framework for developing an integrated system for epidemiological risk prediction and responses. We proposed a holistic approach